Hello everybody, and nice to see you in this last session of the day. And what I'd like to take us through today is a little bit of the history of where we've got to with leadership in the sort of midwifery world. And we base a lot of our work on the standards of proficiency for midwives that were published now back in November 2019. But the standards in this document have sort of two purposes, really. They're what the public can expect midwives to know, to be able to do, in order to deliver that safe, effective, respectful, kind, person-centred care that we all want to deliver. The other point is that it sets the standards for students for their curriculum. So the standards of proficiency for midwives are important to know about if you're a student. They're also important to know about if you're a midwife. And for those of you who are in the revalidation sort of space, it's also in the guidance to, as well as the code, to look at the standards of proficiency when you're revalidating, because it can give you pointers about where you might think of going with CPD and further education down the line. And the history of the development of the standards is quite important, because one of the differences between these standards and the standards from 10 years before, the 2009 standards, was this inclusion of leadership and the midwife as colleague and scholar and leader. And all of this came about from the preliminary work that was done with the Thought Leadership Group, ably led by Professor Mary Renfrew, then at the University of Dundee. And she pulled together a thought leadership group. And I was saying to somebody earlier that by the time we actually got round to launching the standards, we had some people in the audience who had been students who'd been contributing to the preliminary evidence gathering work, and they were actually on the point of qualifying, if not qualified and on the register. And this is just a picture from around the UK of the launches that we did in various places. And it was all, there were a lot of balloons involved, in those days, cupcakes. But the midwifery context was not just local, it was global. We took into consideration the reports that were prominent at the time, the NICE guidance, Embrace reports, reports from the Council of Deans of Health and their input, and then the World's Midwifery Report, which was current at the time. This is an updated slide that talks about the one that was published in 2021, but we used the one that was current at the time. And you'll see there the sort of infographic, as it were, that we based the standards on as well, which was the Lancet series on midwifery. And this is really important because this framework underpins the standards of proficiency. And in it, you'll see that from this, we drew what turned out into the domains, in the sense that there's care that all women and their babies, their infants need. And then there's care that's needed for some childbearing women and their infants with complications. And that's sort of additional care. And the midwifery role within that is first-line management of complications, and then the involvement of medical obstetric neonatal services as appropriate. And then the other bits are about the organisational care, the values, the philosophy, and the care providers. And it's about strengthening women's capabilities, having the knowledge, the respect, the understanding, and tailoring the care to women's circumstances and needs. So this is all really the underpinning of the standards. And it says in that last section around care providers about practitioners who combine clinical knowledge and skills with interpersonal and cultural competence. And it's about the roles and responsibilities being sort of divvied up depending on the need and the competencies and the resources. And from that, we moved into the 6 domains. And they're all important, and they're all interrelated. And you start from at the top with being an accountable autonomous practitioner, professional midwife, then providing safe and effective midwifery care. And we made the deliberate decision to link this with continuity of care and carer, because the evidence is very strong about that being extremely helpful for the baby as well as for the woman. And what's interesting is that that is now starting to come through in other disciplines as a good thing. and those of you who've read the Times 10 recommendations will notice that it was recommending there that the continuity of care comes in for GPs. And we've been saying this for a long time as the thing and the way to go in maternity services. About universal care, and that goes back to that top line. This is the care that most everybody needs from the point of view of pregnant women and their newborn infants. And then the additional care, which is for those with complications. And then we come on to excellence, the midwife as a colleague, a scholar and a leader. And the leadership point was very important because that was sort of new. And it's about the inclusive leadership in the sense that leadership isn't just for, the director of midwifery, the head of midwifery, the community midwifery manager. Leadership starts from your times as a student and goes right throughout your career. And it will wax and wane, and at times you'll be a follower and at times you'll be a leader. But the point is that it's open to everybody and it's for everybody. And then there's the skills all being drawn together in Domain 6, which is the skilled practitioner. So within the role and scope of the midwife, which is the sort of bit at the front that not everybody, I think, necessarily reads, it's actually very clear about the skills, the compassionate care, enabling the human rights, and ensuring that care always focuses on the needs, views, preferences and decision of the woman and the needs of the newborn infant. And it's about that providing of safe, respectful, empowering and equitable care, regardless of the social context and in all settings. And the midwife is responsible for creating an environment. And in a later slide, you'll see I talk about, being a radiator or a drain, and it'll make sense when we sort of think about it in this context. It's the midwife and responsibility for creating that environment that's respectful, kind, nurturing and empowering. That's not just for the women, that's for the midwives and your peers and the whole group in the maternity space. And then this is about the midwife skills that we're inoculating into our students. The critical thinking, the problem solving, positive role modelling, and that's where all our leadership skills come in, about thinking about, are we being a positive role model? And the leadership development, they're all fundamental components of safe midwifery practice. And it's about this leading role in effective management, team working, and encouraging a learning culture, because gone are the days when you did your midwifery education and you never opened a book again. Those days are long gone, and it's a continuous learning process nowadays. And people go off in different directions. For those of us, I'm getting on now to approaching my 40 years sort of milestone for midwifery. I've already passed it for nursing, but I will not go there. So we've got such a range of possibilities now from the point of view of a career, in the sense that it used to be, it was clinical, and you stopped sort of at the sister level, and then you went into education or you went into management, and that was it. So now you've got the options of practice, and practice has expanded. You've got the roles such as consultant midwives and things developing around advanced practice and all sorts of things going on. You've got education, you've got research, you've got management, you've got leadership, you've got policy folk, and midwives working in all sorts of different environments, and continuing to develop and refine their knowledge, their resourcefulness, flexibility, and so on as they go along. And a lot of it is about that ability to critically think and strategically think and focus not just on the here and now, but also where you want to be in the future, and using your emotional intelligence and leadership skills throughout your career. So it's a big ask, and I'm not saying that it's easy, but it's starting with midwives at the beginning of their career. And just the wording and the key points about leadership are in Domain 1, 5, and then 6. And 6 is where the skills are all sort of pulled together. And that point that I made at the beginning about they all interlink and they're all equally important, they all interlink with cultural competency, cultural curiosity, and also the sort of collaboration, working with others, and that point about the midwife being a colleague, and also a scholar, and also a leader. So they're not sort of mutually exclusive. So you're thinking about in the professional behaviours of Domain 1 about demonstrating advocacy and leadership, collaborating and challenging colleagues as necessary in a respectful way and knowing when to escalate concerns. Then there's the Domain 5, which is the one that I've mentioned about the midwife as colleague, scholar and leader, and that's the ability and commitment to develop as a midwife yourself, to understand the career pathways and the options that can include, as we've talked about, a much broader range than previously would have been maybe understood, and to recognise the need to take responsibility for ongoing education and professional development. And there's the positive leadership role modelling and the guiding and supporting of those within the multidisciplinary or interdisciplinary team. So it's not just about interdisciplinary in the sense of your peer group, but interdisciplinary in the sense of the big team, you know, working with students of many disciplines, and also those from your peer group in the sense of the obstetricians and the anaesthetists and the neonatologists. And then thinking about that positive role modelling and leadership. So it does get into sort of nitty-gritty. I'll not, you can have a read through it this rather than me reading every point from, you know, Domain 6, which is the skills section. But just to pick out a few, it's about appropriate resources, making adjustments where recognising where adjustments where appropriate, and facilitating interpretation and translation services, sensory impairments, communication skills. All of this is around communication, but again, very important in the context of leadership, and in effective communication with interdisciplinary and multi-agency teams, particularly in those challenging and emergency situations. And a lot of that is learning together and having a mutual approach, an agreed way forward and an agreed vision of how you want together the maternity service to function. And we've been doing some research back at the NMC, and I've put the links there and also the QR code, which will take you into that sort of particular page. But some of the stuff that's coming through is showing that professionals are experiencing discrimination that impacts on care. There's also inconsistent preceptorship. So depending on where people go for a job, they're getting inconsistent sort of approaches to preceptorship. And while we write the principles document, the preceptorship programs that are put on are dependent to a large degree on the trusts, and that's where the leadership comes in, because it's really around seeing how important preceptorship is for making people feel supported in that first nerve-wracking time of being a midwife, where you're suddenly like, ooh, I'm by myself, I'm not a student anymore. So you've got to think about that in the context of leadership and supporting people when they are new. And also not just the students, anybody coming in who's coming in from outside the UK to their first job as a midwife in the UK, anybody who's moving from either another hospital or from another area of the hospital to wherever you're working. There's something there about the support and thinking through the leadership to support them as they gain confidence in where they're working. The extent of the discrimination is also in our Ambitious for Change report, which was looking at our sort of fitness to practice processes and, you know, the evidence of racism that's coming through, in the sense that black males tend to be much more referred to the NMC than other groups. So that's an interesting one to pick up on, you know, where sometimes I think things can go awry. There's also something about, within the NMC, there are options to talk through things beforehand in the fitness to practice sense. We have an employer liaison service or an employer link service, ELS, who will talk to employers where and if a referral is being thought of, to see whether it actually needs to be a referral to the NMC or whether that would be much more appropriate to be sorted out locally, because not everything needs to be referred to the NMC, and it shouldn't be used as a stick, as a management tool, or as any sort of a threat. It should be, in a way, a position of last resort where everything local has been tried first to get people back to where they need to be, on the principle that people don't get out of bed to do a bad job or to cause harm when they go to work. And that would be where we would be starting from. Is this something that can be dealt with locally and remediated locally, rather than going for the big sort of approach of referral to the NMC? So all of this research is helping us to think about what we can do from the NMC as the regulator point of view to support people and to make things, helping them to speak up, but also to show that we're listening and that we're taking on board what this research and people are telling us. So there you'll see the equality, diversity and inclusion research and ambitious for change, and protected character and the processes around protected characteristics, and then the perceptions research as well, if you want to look at that in more depth afterwards. And when we're thinking about leadership styles, there's a lot. The point of the standards is not to tell the universities how to teach leadership, but you will be thinking around the types of leadership, and there will be consideration of the types of leadership that have been and gone, but you still may find remnants around the place. And many of these are just, we've all come across the visionary leadership, the servant leader, the autocratic, laissez-faire, hands-off, democratic, and the pace-setter, transformational. That's about challenging, being challenging and communicative. And then the transactional, bureaucratic, which is a rather heavy-handed, I would say, and hierarchical, but won't be probably unfamiliar to any of us in the room. And then the more modern way of thinking about leadership is now into very much the sort of coaching model of leadership, and that's all about motivational leadership. So there's different ways, and it'll be taught to students. So again, from the point of view of being a midwife, it's useful to know about the leadership elements that are in the standards of proficiency that you will be coming across when you're working with students, and that they're being taught and working through at university level. And then this is just, a sort of visual reminder of an illustration of some of those types of leadership, because we'll all be very familiar with the sort of hierarchical leadership, and anybody who's down from sort of Plymouth way will recognise the chap at the top. And then I'm thinking of leadership in the terms of sporting leadership. That's often seen as being the best at your particular field. And then we have Mary Seacole, we have founder of the NHS, we have Jackie Dunkley-Bent, who's showing leadership in an international arena now, and also Baroness Cumberledge, who's been a long-term friend of maternity services and midwives, and emphasising the importance of compassionate care and women's voices. And then, of course, Florence Nightingale down there in the corner. So all different types of leadership, but all working in this sort of context of thinking about the different types of leadership and which one works best. And going back to my point about leadership, you always have to be just mindful of a couple of things. Somebody once said to me, and I thought this was terribly clever until I found out that it's a quote from multiple sources, but the gist of it is that if you think you're leading but nobody's actually following you, all you're doing is going for a walk by yourself. Or as they would say in Northern Ireland, all you're doing is going for a dander by yourself. So the key point is that your leadership should be in the arena of inspiring others, and also learning more, doing more, and becoming more. And this one I'm really quite fond of, which is followers who tell the truth and leaders who listen to it are an unbeatable combination. And that links in with what we're working on around, making it easier and not a bad thing to raise concerns, so that it's something that is part of the learning culture in an organisation, and that learning culture comes from the leadership. And many of you will be familiar with this. I'm not going to play it, but it's worth, if you want a little bit of light entertainment, this is The First Follower. And it builds on the principle that at some point, this is all based on what seems to be a rave or a dance or a festival that for some reason seems to be virtually on a cliff top, and some chap stands up and starts doing sort of mad dancing, and he's dancing by himself for a bit, and then one person joins, and that's the first follower, and then another person joins, and then another person, and it's that principle of, as your style of leadership needs to bring other people along so that you're not just walking by yourself. So at the end of it, everybody's standing on the cliff top waving their arms around in the sunshine. And I'm not suggesting that that's a good model for a delivery suite, but you get the gist of what I'm aiming for. You must be easy to follow, and people must want to follow you in your leadership style. And this is this thing about leading by example. Again, none of us want to be seen as the sort of the drain of emotions at work, or the drains of joy. You would all like to be the radiator, or the person that makes other people feel better about coming to work. I mean, we've all probably had the situation where we think you're looking at the line of the off-duty thinking, who am I on with? And wanting to make sure that you're on with somebody that you're going to enjoy working with. And you're trying to avoid being on the line that means that you will be working with somebody that you think, oh. So I would say on that front, it's up to all of us to lead by example. Be the sunshine, be the radiator. And if you've ever met somebody that was sunshine in human form, I'm not saying stalk them, but learn from them and, in essence, tag them, learn their style and learn what you can from them. Because we've all had them, and I can still remember the names of the midwives that I learned from when I first went out as a community midwife, because I just liked the way they were. I liked the way they worked, I liked the way they were with women, and I liked their efficiency and also their knowledge, and they were startlingly good. And they probably got very annoyed with me sort of following them around, haunting them. But we've done some work at the NMC, and we did a little mini campaign on the basis of the tagline was good leadership means better care. And it's building on that idea. For every successful team, there's a supportive leader, and it's about being supportive. It's not about the glory or the power of leadership. And when you go into it, there's a whole section on the webpage about good leadership and what it means and the range of behaviours and so on. Such as speaking up to advocate for patients, to raise concerns, supporting teams in pressurised environments and inclusive working environments for people from a diverse range of backgrounds. So again, it's that idea of inclusivity. And leaders can be found at all levels of nursing and midwifery, and that's what we've been talking about this afternoon. It's about effective management and positive role modelling so that you're getting best practice and delivery of care by the teams within the organisations. So again, QR code will take you there, but when you get there, what you'll see are stories, and the drop-downs will give you people's sort of little blog on what good leadership means to them. And two of these are midwives. And for many of you, their names will be very familiar. So Wendy, who's the National Maternity Lead at NHS England and NHS Improvement, has said, show me the environment and I will tell you the kind of leadership in that place. If staff are smiling and welcoming, it's because the leader is smiling and welcoming. Staff follow the leader as a role model, and the leader's relationship with their team translates into making such a big difference to the care provided. So that's the sort of trickle-down effect of good, supportive leadership, and hopefully a little bit of sunshine thrown in. And then Shona Hamilton, who's a consultant midwife in Northern Ireland, is talking through the leadership around helping their teams to advocate for women in their care. And she's saying leadership is about showing we advocate for women and that they have choice, enhancing our midwives' knowledge. And in the leadership terms, that's about making sure that everybody has access to the CPD, to the leadership courses, and has access to that continuing professional development. And it's important to pause and give positive feedback And again, it doesn't have to be positive feedback when something it's just positive feedback about the small things and on a regular basis, so that people do know that you recognise what they're doing, that you're supportive, and you're acknowledging that they're doing a good job. Because that's really important at a sort of basic level for all of us. You want to be recognised, you want to be understood, and you want to have people know that they know that you're doing a good job. So it's about being important to pause and give positive feedback, saying that woman really appreciated what you did for her. And we can't expect midwives to provide high quality, safe care unless they feel psychologically safe themselves. And that goes back to the talk we heard this morning from Claire Feely around the fact that safety is much more than risk management. And for her, the understanding was that emotional safety is absolutely crucial. And we talk in the standards about safety in the broadest sense of, cultural safety, psychological safety, physical safety. And again, that applies to both the woman, but also the emotional safety, very important from the point of view of the midwife. And just a little bit about NMC resources. You'll all be working with students in one way or another, and these little bite-sized animations are very good sort of snappy introductions to the code, and be quite useful when you're supervising students or even thinking about your own revalidation. And while they're not specific to midwifery, they do cover the points in the code around professionalism and delegation, speaking up and so forth. And we've got resources for students now. It's a sort of student hub, so we've tried to pull everything together, and that includes, the student newsletter and thinking about duty of candour, which is a joint GMC and NMC sort of position statement, and things about what students can do around raising concerns and so on. And I was talking to some folk earlier about the fact that we have 3 resources which we intend students to see in year 1, year 2 and year 3. And it's folk from the NMC talking about the NMC, but not just about fitness to practice, because we still unfortunately hear students saying that they're worried about losing their PIN, which is extremely concerning considering that they haven't even got their PIN yet. So, and as I said earlier, the NMC shouldn't be used as a threat or as a sort of stick in a management sense, and it shouldn't be sort of a sort of means of defensive practice and highlighted as such to students. So what we've tried to do is to have these 3 videos for students along the way, so in their first year they get a little introduction to the NMC's roles during their education, because one way or the other, whatever it's called, whether it's the NMC or has another name, there will be a regulator that will be part of the story from the time as a student, throughout your midwifery career, and also with continuing professional development and so on. Then there's a second one for second year, sort of about getting the best out of your education, and that talks about the standards for student supervision and assessment and how students can look after themselves in their practice learning environment. And then about finishing your programme, what's next? That's about the sort of transitioning over into the professional midwifery world as they prepare to join the register. So all those are available online, and again, you can tell that when I was preparing this presentation, I just got the hang of, there was a thing that would turn your page into a QR code. So I got slightly carried away and stuck QR codes on nearly every slide, but hopefully it's helpful. And there's also that information hub around understanding the SSSA or the student supervision and assessment. There's some ongoing work that the NMC is moving into, which again is linked to leadership in the sense of CPD and development and so on. And we're carrying out a review of advanced nursing and midwifery practice. And I suppose it's important to say that midwifery wasn't originally in the picture, but then we had to make the point that there are midwives who are in and have advanced practice in their title. So it makes sense to involve midwifery at this stage, and what Council decide to do will be agreed in March at the Council meeting. So we've done a lot of preliminary talking to people, having webinars, so on. And we've got a lot of advanced practice sort of midwives and nurses actually working for us, going out and about at the minute around the UK, talking to people about what does advanced practice mean to you, how do you see advanced practice, and also getting feedback around what other people understand about advanced practice. And what has sort of come out so far from the research that we've been doing is that although nurses and midwives are taking on advanced practice roles, it's not particularly clear whether people who use the services and the public sort of understand this and understand what it means. And I'm not even sure that the professionals do. So to be frank, there's work to be done on this one. So watch this space. And I think there's a webinar coming up on Thursday, which you could probably book into via the QR code, which has got so far 60 midwives who are going to be considering and talking about advanced practice and what it means to them and what they think it could mean to the public and women going forward. And those are just the advanced practice links. And there's an email there and again the website. So that's me. Thank you very much.